Before donning protective equipment, remember to remove any personal items such as stethoscopes, pagers, cell phones, and handheld devices, as they could become contaminated. The preferred way to put on full PPE is to start with the gown. The mask or respirator should be put on next and properly adjusted to fit. Then put on the goggles or face shield. The gloves are last. First, select the appropriate type of gown for the task and the right size for you. The opening of the gown should be in the back. Then secure the gown at the neck and waist. When selecting a gown, you must decide whether it needs to be fluid resistant, fluid proof, or neither. If it is possible that fluid might soak through your clothing, then a fluid resistant or fluid proof gown should be worn. Masks should fully cover the nose and mouth. They should also resist fluid penetration. If a mask has two sets of ties, place the mask over your mouth, nose, and chin. Fit the flexible nose piece to your nose bridge. Tie the upper set at the back of your head above your ears and the lower set at the base of your neck. If a mask has an elastic headband, hold the mask in one hand and the elastic in the other. Place and hold the mask over your nose, mouth, and chin. Then stretch the elastic over your head and secure it comfortably. If respiratory protection is required, such as caring for patients on airborne infection isolation precautions, a fit-tested NIOSH-approved respirator should be used. Particulate respirators are worn to protect healthcare workers from inhaling airborne infectious agents. Respirators should always be donned before opening the door of an airborne infection isolation room. Goggles should feel snug but not tight around the eyes and should wrap around the sides of the face. If possible, select goggles with anti-fog features that will help maintain clarity of vision. Face shields protect facial skin in addition to covering the mouth, nose, and eyes. To be effective, face shields must extend from the brow to below the chin and wrap around the sides of the face. Place the face shield over your forehead and adjust the band to fit comfortably around your head. Select the right size and type of glove needed for the task. Gloves should fit snugly around the wrist if a gown is also worn or if contact with a large volume of blood or body fluids is likely. If you are wearing an isolation gown, tuck the gown cuffs securely under each glove. This provides a continuous barrier for your skin. Most patient care activities require only a single pair of non-sterile gloves. Once you've put on the PPE, avoid contaminating yourself by keeping your hands away from your face and not touching or adjusting the PPE. Avoid touching surfaces and items in the room.